In a world where healthcare problems are becoming more costly, more complicated, multifaceted solutions that draw from different academic disciplines are needed more than ever. This is how I do that in bridging epidemiology and business. Over the summer, I had the opportunity of working with Dr. Kevin Gibbous in the Brown University Department of Infection Prevention and Epidemiology. As you can see here, this was the product of one of our first initiatives to increase hand hygiene compliance. We implemented a Petri dish campaign wherein volunteers at Rhode Island Hospital could see the impact microbially of inputting hand hygiene compliance in their systems. From a business point of view, this called on my expertise in management and motivation, because if you could see the impact microbially of your habits, you were able to change your behavior. But that's not all we did. We also internally evaluated the internal audit system at Brown University Health and Rhode Island Hospital. What does that mean? The internal audit system goes something like this. A doctor or a nurse has the ability to comment on the hand hygiene habits that they witness within the department. That is then aggregated to a percentage of audits, whether it's compliant or not. We wanted to raise that compliance rate. By evaluating the internal audit system, I could identify information bias within the reported data. We sent a survey to those that submitted audits from January to July 2024 and got 76 respondents. A key finding was that those people who provided feedback varied significantly on the person they were providing feedback to. What does that mean? 54% of survey respondents felt very comfortable providing hand hygiene feedback to nurses, but only 22% felt very comfortable providing feedbacks to attending physicians. Now, this may seem obvious that certain hierarchies exist in medical spaces, but having tangible data to support this is crucial for making workplace environments centered around accountability. That's where my management degree came in, as I was able to design questions that evaluated the organizational structure. And lastly, the third initiative that we implemented was based on an external audit system. Patients and visitors had the chance to comment on the hand hygiene habits that they see. From a management point of view, this had to be marketed correctly. Marketing materials had to be made pretty with graphic design, and translators were used to help make the advertisements accessible to different populations. And so, what was the result? Of these three very different initiatives, what was the impact? I'm pleased to report that there was a 15% increase in hand hygiene compliance throughout Rhode Island Hospital from May to August 2024. And so, why does this matter? Why does this research matter to those not in business or in healthcare settings? Wash your hands. Duh. Show your body that you're grateful for it by taking 20 seconds out of your day and more to wash your hands. But secondly, be aware of the social hierarchies that exist in your life. Who would you feel comfortable providing hand hygiene feedback to? Your professor? Your boss? Your roommate? I implore you to think about these things. And lastly, I want to end my talk with an inspiration and a challenge. In my career, I am centered to combine business acumen and epidemiology expertise. In what seems like two wildly different fields, I find effective harmony that drives innovative results. Whether it's evaluating the costs of a study design or engaging in public health policy negotiations, I use my business degree from Bryant University and my master's of public health from Brown University every single day. And so for those in the audience and those watching at home, I implore you to think about the lived experiences that you have and how you address your problems. What fields of study do you combine to bring life-changing solutions? And so, while the research does matter, so does the researcher and the unique blend of perspectives we bring in solving problems and creating new knowledge. Thank you so much.